Firstly, we'll talk about specific phobia. We'll learn how phobias develop. We're going to discuss social anxiety disorder, panic disorder, as well as generalized anxiety disorder. Now, it's important to make the distinction too before we get into anxiety-related disorders. Fear versus anxiety. Fear is an instantaneous reaction to an imminent threat. This is whenever your nervous system is responding to a perceived threat that it may cause harm to your health or well-being. Now, anxiety, on the other end, is apprehension, avoidance, and cautiousness regarding a potential threat, danger, or other negative content. And anxiety inherently is not a bad thing because it's effectively motivation for us to take action and to avoid certain things. There's a protector in us that is there for a reason to help us in certain moments. But sometimes anxiety can be so overwhelming and so distressing that, again, going back to earlier definition, it causes so much distress to where it affects your ability to operate socially, occupationally, and in other areas of functioning. So if you're unable to go through day-to-day experiences or actions, then that may be a potential cause for concern. Whenever the anxiety is so overwhelming that it's incongruent with the actual reality of the threat, we may take a step back and see and look a little bit further into this. What's going on here? Okay. So anxiety disorders, as I mentioned, characterized by excessive and persistent fear and anxiety and by related disturbances in behavior. Now, the prevalence of anxiety disorders affects about 1 in 4 individuals in the United States during their lifetime and is more common in women than in men. It's actually, too, the most frequently occurring class of mental disorders. All right. First disorder we will be kicking off with is specific phobia. This involves excessive, distressing, and persistent fear or anxiety about a specific object or situation. Okay? And people, they may realize that their fear and anxiety is irrational, but they'll still go to great lengths to avoid the stimulus. And whenever it comes to anxiety as a whole, the reason that anxiety continues to grow over time is because we engage in safety behaviors or avoiding behaviors. The one way that we can get through an anxious situation is by exposing ourselves to it incrementally and in small doses, systematic desensitization, which we'll talk about in chapter 16. And so it's a negative reinforcing process as we talked in chapter 6, where you have the anxiety-provoking event or situation or person or thing, and when you avoid it, yes, it is productive in the short term, but long term it is not. Just because something is effective in the short term does not mean that it is productive in the long term. That's important to know. Now, some specific phobias include acrophobia, which is heights, aerophobia, flying, arachnophobia, spiders, and claustrophobia, the fear of the fear of enclosed spaces. All right, that was my bad dad joke for the day. No more after that. All right. Now, agoraphobia is listed as a separate anxiety disorder. It is characterized by intense fear, anxiety, and avoidance of situations in which it might be difficult to escape or receive help if one experiences a panic attack. And these situations include public transportation, crowds, being outside the home alone. Okay, so how do phobias occur? Well, there are a few ways in which they can develop. First is classical conditioning. The event actually happens to you. You have an adverse experience with a particular stimulus. So let's say you're bitten by a dog at an early age. You associate that dog with getting bitten or the pain associated with getting bitten. So based on the law of effect, we're more likely to engage in behaviors that yield a pleasant consequence and less likely to engage in behavior that yields a neutral or an unpleasant consequence. I know that's more so operant conditioning, but it remains true still and related to this right here. You're associating a stimulus with something that's unpleasant. So therefore, down the road, you're more likely to experience anxiety or fear that's incongruent with the reality of the situation. So you may have a as I just mentioned, you may have just an incongruent fear or anxiety through the process of classical conditioning. So the event actually happens to you. Next, number two is vicarious learning. We don't always develop a fear by we experiencing it for ourselves. We can see other people stick their hand in a fire or on a stove and understand that, hey, we shouldn't do that ourselves. We don't have to learn directly whenever we see somebody get burnt, that we don't stick our hand or any of our extremities near something that's extremely hot for a long period of time, because it can result in pain or burning. Okay, so vicarious learning. A child observes their cousin react with fear around spiders. So that child later expresses the same fears even though spiders have never presented any danger to them. So no, they didn't experience getting bitten by a spider or a fearful event with a spider, but they see somebody being fearful, so maybe I should be fearful as well. Next is verbal transmission of information. Now, again, it doesn't happen directly to us. We don't see somebody else being fearful, but when we hear about somebody having an unpleasant or a scary experience, we may develop that fear as well. So, for example, a child is continuously told that snakes are dangerous, therefore, the child starts to fear snakes. So, under classical conditioning, did they experience getting bitten or having a bad experience with a snake? No. With vicarious learning, did they see somebody being fearful of snakes and then they later developed that anxiety? No. They simply heard somebody talk about it. Now I know of somebody who developed a fear of movie theaters as a result. Back in the day, there were mass shootings at movie premieres. And did they experience the event directly? No. Did they see the event take place? No. But they did hear about it through news channels and other outlets that were describing the events. So therefore, they developed a phobia of movie theaters. So there's a number of ways in which we can develop phobias. It's not a one-size-fits-all. Next, let's talk about social anxiety disorder. When it comes to social anxiety, this is characterized by extreme and persistent fear or anxiety and avoidance of social situations, because as we mentioned, avoidance is a surefire way to increase the anxiety in the long term. And this is where also a person could be potentially evaluated negatively by others, leading to serious impairments in life. As mentioned, we discussed safety behaviors. To give a definition to this, these are mental or behavioral acts that reduce anxiety in social situations by reducing the chance of negative social outcomes. So some safety behaviors we may engage in include avoiding eye contact or rehearsing sentences before speaking. It affects about 12% of Americans during their lifetime, and there's a high rate of comorbidity with alcohol use disorder. Now, this is important to note too here is the reason why alcohol is commonly used in social settings is because it can be used as a social lubricant. And yes, it again is effective in the short term at reducing anxiety and allowing people to talk to others that they may not be able to otherwise. But this is not a productive outlet to use long term because, again, using alcohol is kind of like a safety behavior where it temporarily reduces the anxiety, but then an individual may find themselves in a place where they can't socialize without using alcohol. And that is not something that is a productive behavior. As well as alcohol use disorder, we don't call people who abuse substances as alcoholics in a clinical setting. We say that they have a substance use disorder, and there's a specification on which drug of choice they are using. So in this case, alcohol use disorder. Now, whenever it comes to risk factors, fears of social situations possibly develop through conditioning. And this is important to know. 92% of a sample of adults with social anxiety disorder reported a history of severe teasing in childhood. Again, going back to early childhood experiences and how that affects us in adulthood, as well as classically conditioned associations where we have an unpleasant experience within a social setting or multiple unpleasant experiences through bullying or teasing, and then that can later develop into social anxiety disorder. Next, panic disorder. These are recurrent and unexpected panic attacks, along with at least 1 month of persistent concern about additional panic attacks, because we know when it comes to panic disorder and panic attacks in general, the fear of just having another panic attack can cause one to onset or to occur. As well, worrying over the consequences of the attacks or self-defeating changes in behavior related to the attacks. So if you don't know what a panic attack is, let's define it. It's a period of extreme fear or discomfort that develops abruptly and reaches a peak within 10 minutes. So what an individual may experience is a shortness of breath, chest pain, palpitations, accelerated heart rate especially, nausea or abdominal distress, as well as feeling dizzy, unsteady, and lightheaded. A very unpleasant experience. And some people, if they've not experienced a panic attack before, they may think that they're having a heart attack or that they're dying. Those are common phrases that are stated whenever an individual has a panic attack. But they don't last a significantly long amount of time, relatively speaking, but whenever you're experiencing it, it seems like it's a lot longer. I can assure you of that. Okay. Now, when it comes to panic disorder, there are some genetic components or theories behind why we experience them. So there's apparently a 43% heritability rate. So if your biological parents have panic disorder, you may experience panic disorder in your lifetime, and that's a pretty significant percentage there. And there are a number of areas of your body that may be involved in panic disorder, and they're listed throughout this slide, so I'm not going to read them off to you, but I'll let you kind of pause and take a look for yourself throughout all this. I do want to kind of keep things moving and try and keep your attention throughout this, because I know this is a lot of information in one setting. So let's keep it moving and talk about generalized anxiety disorder. This is probably the last one we'll talk about in this section, and then we will move forward. So generalized anxiety disorder is defined as a relatively continuous state of excessive, uncontrollable, and pointless worry and apprehension. So the anxiety is not specified on one particular area. It's, again, just a generalized state where the anxiety is so distressing that it causes harm in your ability to operate occupationally, socially, other areas of functioning, and it can have a number of other symptoms that include restlessness, difficulty concentrating, being easily fatigued, muscle tension, irritability, and sleep difficulties. Now, to be diagnosed with GAD, the symptoms as mentioned, have to occur more days than not for at least 6 months. Okay, so you can't just experience these symptoms for a few weeks or a month. This needs to be a persistent difficulty. And as mentioned, to round this off, it's diffused worrying. It's not specified on one particular object, stimulus, or situation. And the apprehension is not part of another disorder. Okay. Now, when it comes to the prevalence, it affects about 5.7% of the U.S. population during their lifetime, and females are twice as likely as males to experience the disorder. And there's a high comorbidity rate with mood disorders and other anxiety disorders. Okay. Now, when it comes to the cognitive theories of GAD, the worry represents a mental strategy to avoid more powerful negative emotions, perhaps stemming from earlier unpleasant or traumatic experiences. Again, a perspective where environmental causes in childhood can lead to the onset of particular anxiety-provoking disorders. So that first bullet point there, worrying acts as a distraction from remembering painful childhood experiences. As we'll talk about in the next 2 chapters, your brain is really good at protecting you through biases, through defense mechanisms, but especially when it comes to painful memories. your brain can take a couple ways where it fragments that memory or represses it altogether, or it can show through in persistent or intrusive memories. So maybe as a side effect of this, your brain may worry so it can distract you from experiences from childhood. Okay, but still, it's an unpleasant, no matter if it's you're experiencing the memories or the worrying or anxiety, still a very unpleasant state to be in. Okay.